Hi, everyone. It's good. All right. Thank you so much for coming today. Thank you to Cleveland Public Library and Lamar for hosting this event, and thank you to each of Susan Lasch, Steve Porter, and Dana at Langford for joining me. So I'm guessing there's a mix of people here today. People who know my personal story and have read my novel Mathey Girls, people who have read Mathey Girls but don't know much about my personal story, and people who haven't read Mathey Girls but are interested in maternal health issues or writing or both. Thank you all. I think today's discussion is a really unique opportunity to bring different worlds together in a meaningful way. So I'm going to start by telling my story, and after that, we'll have a discussion with our speakers who have generously given their time and expertise. And there will be a book signing after the event, and then there's also a table for Village of Healing over there if you want to take a look. So here we go. I am not a maternal health expert. I am, however, a mother of 3 who almost died when giving birth to my 3rd child, my son Ben. I was born and raised in Cleveland, and after college and law school, I started my legal career in Hong Kong and then Beijing, China. In Beijing, I married my husband Eric, and we had a daughter, Violet, who's in the audience. We moved back to Cleveland in 2014. I had my 2nd daughter, Zoe, while living in my childhood home on the west side. And in 2016, we moved to Shaker Heights, where we are now. In March of 2018, I was at UH main campus getting induced to deliver my son. As my husband and I waited for labor to progress, we joked to each other how it was going to be weird having a normal postpartum with this 3rd kid, because when Violet was 2 months old, my mother passed away after a long illness, and Zoe was born with a hole in her heart and had open heart surgery when she was 3 months old. So what were we going to do with these 3 months of normal babyhood and unfettered maternity leave? Now, before I continue, I want to say that I'm not going to go into all the details of that day, to spare you and to spare myself. It's a lot. The details I am going to provide are still pretty dramatic, so be warned. For Violet and Zoe, I had delivered vaginally without issue. In each case, I had an epidural, and it was all very normal in terms of birth and recovery. The 3rd time around, it felt the same, hours of expectant waiting for the new baby to arrive. The transition from everything is fine to something's terribly wrong was sudden and violent. I changed position to help move things along. Almost immediately, the baby's heartbeat dropped and I started to shake, feeling extremely ill. Things got blurry. I was rushed to an OR where the doctors asked me to push, pleaded with me to push, but I seemed to have lost all of my strength. They had to do an emergency C-section. When the baby was born, he was unresponsive, and instead of bringing him to me, the staff rushed him to the NICU. As a mother who had given birth twice before, this itself was terrifying, that I didn't even get to see my baby when he was born. Throughout the C-section, I was conscious but not fully with it. Now that the baby had been born, I didn't understand why the room was still so alive with noise and movement and chaos. My vision and hearing went in and out, though I remained very aware of the bright lights and shouting. I felt repeated injections on one side of my neck and then the other, and then back again, and they burned. I was coherent enough at one point to ask out loud whether I was dying. The doctor next to me told me to save my strength. This was not the answer that I needed to hear in that moment. As I faded into black, I just thought to myself, Violet and Zoe, hold on for them, Violet and Zoe. I woke up in the ICU on a breathing tube. I had no idea what had happened. I didn't know where the baby was, if he was alive, if he was okay. It was only after I got out of the ICU that I was given the full picture. This is what I was told. I had experienced an amniotic fluid embolism. This was an extremely rare event with a very high mortality rate. The baby was alive, but he was in a cooling blanket, a kind of forced hibernation for 3 days, to hopefully prevent brain damage from the inflammation caused during the traumatic birth. In the OR, the amniotic embolism meant that my body wouldn't stop bleeding after the C-section. My body had turned off its normal blood clotting factors. I was transfused with over 40 units of blood product. The burning injections I had felt were the repeated transfusions of blood and plasma, the doctors trying to keep up. I kept bleeding out the blood that they were giving multiple times over. At one point, I had gone into VFib. A code had been called, and I was shocked back to life. When your body can't stop bleeding, it starts to selectively let organs go, trying to protect the heart and brain for as long as possible. So, the doctors told me, I had lost most of my reproductive organs, and my kidneys were shot, and I had liver damage. Because of my non-functioning kidneys, my body wasn't processing fluid, and even though I had delivered an 8-pound baby, I was extremely swollen and weighed just as much as before I delivered. And of course, I was told I wouldn't be able to have any more children. As I learned all of this in the days after the delivery, and as I was dealing with a profound sense of shock and loss, I was also repeatedly told that I was very, very lucky. Because I was healthy going in, because I didn't have any other comorbidities, I just barely survived, and it was a miracle. I have to admit, I struggled with feeling blessed that this had just happened. It was traumatic in many ways. My body was absolutely wrecked, and the baby's future health was uncertain. I don't know how many of you in the audience have experienced some form of traumatic birth, but it comes with a huge sense of grief that this experience, giving birth to a child, is now something associated with fear and with sadness and with loss, even if the mother and baby survive, as in my case. After my son spent his 3 days under the cooling blanket, his tests indicated that he hadn't suffered serious brain damage. It would take about a year of follow-ups with all manner of specialists, neurology, cardiology, some PT, before we were told he should be fine. I remember crying on the drive back home from his last 1-year follow-up, cardiology, with a year's worth of uncertainty finally lifted. As for me, I spent about a week in the hospital and went home to recover. Physically, it took me about 2 months before everything was back to normal, especially with my kidneys as they had suffered the most damage. I also saw a PTSD psychologist at UH for a couple months to help me process. Ben is now 7, completely healthy, and we are both totally fine. I recognize now that I was extremely lucky to survive, and that I'm lucky that I was in a major hospital with adequate donor blood supply and amazing medical professionals who recognized what they needed to do in that moment. In fact, Dr. Lasch and Dr. Porter were both there in that operating room when I was bleeding out and everything was going wrong. Dr. Lasch was my OB attending, and Dr. Porter was OB chief resident at the time. So now, in the most awkward and emotionally vulnerable and public way possible, I would like to say thank you. So thank you for saving my life, and thank you for saving the lives of other mothers and babies every day. Fast forward almost 8 years, and here we are. I'm now more writer than lawyer. My debut novel, Mathey Girls, was published this past May. If you've read the book, you will recognize some of what I just described. In Mathey Girls, the main character's best friend dies from an amniotic embolism. And in the book, the main character shares some of the feelings I have felt, and my loved ones have felt, about this type of incident. How does this happen? How, in our age of amazing medical and scientific knowledge, with all of the resources that we have as a society, does a healthy woman die during childbirth? We don't know enough about amniotic embolisms to prevent them. That is a reflection on our priorities as a society. But there are other maternal issues that we can be aware of and prepare against, as we'll discuss later. I'm going to leave the medical aspects of the discussion to the experts and talk a little bit about the emotional side. The most lasting effect of the experience has been dealing with the trauma of having a difficult childbirth. After seeing the PTSD psychologist, I thought I was fine. Still, when I attended a Zoom baby shower 3 years later during the pandemic, and we began to chat about labor and delivery and epidurals, my body rebelled. My heart careened in my chest. I watched my hands shaking on my armrests. It was a sad surprise that I wasn't over it, after all. In the weeks after Ben's birth, I eased myself into speaking about my experience, and I know that speaking about it helped me process. It took even longer, years, to be comfortable writing about the experience, because writing about something requires a type of objectivity and empathy that is very removed from the first-hand experience of trauma. To be clear, Mathey Girls is not about maternal health. The novel doesn't focus on the mother who passes away or on amniotic embolisms, but instead on her best friend and their group of friends since college who have to deal with the aftermath. The seed for this novel was planted in 2 distinct personal moments. One was when I made my first trip downstairs after arriving home from the hospital. I was sitting in the playroom with Zoe, who was then 2.5. I watched her play, and it struck me that in another universe, I wouldn't be there. In that other universe, she would still be playing, but her mother would be gone. I still remember viscerally that feeling of disbelief and how thin that line was, the line between those two realities. The second moment happened during a conversation with one of my college friends, a real-life Mathey girl, over WhatsApp, also in the first few weeks of recovery. She said that she didn't know what our college friend group would do without me, because I was one of the members that had kept the group connected over the years. I was struck by that idea. The idea of long-standing friendships where people's lives over time diverge and evolve, but the friendship stays true despite all of their separate journeys. What happens when this type of friendship is rocked by a sudden, unforeseeable tragedy? I say unforeseeable because the thought that I might die from delivering my third child after already having two was non-existent in my mind. As a society, we don't recognize the gravity of what we are doing when we give birth and the risks involved. And I'm not saying that pregnant women should go into this with anxiety or fear, but I do think that being informed can make the whole process less traumatic if something does go wrong. After all, according to Cleveland Clinic, up to 1 in 3 mothers experiences a traumatic childbirth. In 2022, there were approximately 22 maternal deaths for every 100,000 live births in the US. In Ohio, that number is slightly worse than the national average, about 24.5. That is much higher than any other high-income country. For comparison, in Canada, that same number for 2022 was 8.4, and in the UK, it was 5.5. For Black women in America, the numbers are significantly worse, over 50 maternal deaths for every 100,000 live births. Black women are also more likely to experience postpartum depression, preterm birth, and poor infant health than white women. Just 2 weeks ago, Dr. Janelle Green-Smith, a Black maternal health advocate from South Carolina, died while delivering her first child. This isn't just statistics. This is a maternal health crisis. At a societal level, if we are more aware of this issue, we will see more research and resources put into preventing bad maternal outcomes. A growing acknowledgement of racial disparities will, I hope, improve standards of care for Black women. All of this information is difficult. I know. It's not fun to talk about tragic things happening during an experience as sacred and beautiful as childbirth. But these discussions need to happen, and they need to happen often and among disparate groups of people who don't necessarily know this information. This is especially important in an environment where reproductive rights are being taken away. There is a horrible irony in trying to encourage women to give birth more, or trying to prevent them from terminating pregnancies while ignoring the life and death stakes involved in giving birth. Thank you for listening. I'm so grateful that I can be here sharing this moment with you, and I'm so grateful that you all came to hear my story.
Hi, everyone. I am Dana Langford. I am a certified nurse midwife, but I also have the pleasure and privilege of being the CEO and founder of Village of Healing and the Village of Healing Center. We are a community development organization, but a healthcare center that is a nurse practitioner-run healthcare center focused on Black providers caring for Black patients. We currently specialize in obstetrics, gynecology, primary care, pediatrics, and mental health. And we have been open for 3 years. We have 2 sites.
I'm Susan Lasch. I'm an obstetrician gynecologist at University Hospitals. I recently became the medical director of Langford Delivery.
Hi, everybody. My name is Steve Porter. I am also an obstetrician gynecologist, and alongside my clinical practice as an obstetric hospitalist, I am the CEO of a digital health startup company that's focused on perinatal safety, perinatal patient safety.
Okay, so first question, so for Susan and Steve. So I'm not sure how much you remember from my delivery in 2018, and hopefully it's not as traumatic as for you guys as it was for me. But if you have anything that you would want to add or correct about my experience, please feel free.
Nothing really to correct. I mean, I think Eric knows it was traumatic for me too, because every time I saw him, I would cry.
I could never forget your delivery, your birth experience. It was one of the most impactful moments in my residency training, and something that has really stayed with me over the years. When I reflect back on what I was experiencing at that moment, my initial reaction was just being flabbergasted, being truly bewildered that this was actually happening. Because as obstetricians, we perform C-sections routinely. We perform them sometimes multiple times per shift, multiple shifts in a row. And so it was just truly flabbergasted that this was happening. And then that feeling quickly turned into fear. Fear about what might happen. And then eventually into gratitude that we were in a quaternary medical center with all of the resources imaginable to be able to recognize and respond to this life-threatening condition that, as you mentioned, is a exceedingly rare pregnancy complication that has a very high associated mortality. And we were very fortunate that we were just up the road with OB anesthesiology and GYN oncology and an ICU down the hall to be able to respond to it. The other piece that I will share just on a personal level is that I've always felt a deep connection to you and your story because we actually share a lot of commonalities. I know that you went to high school with my wife. We both attended the same university. Princeton, in fact, just a couple of weeks ago was on vacation with 6 other Princeton families, half of whom were Mathey Girls themselves, actually. And my daughter was born just a few weeks before Ben was born, and so was also a new parent at the time. So I felt so many connections with you and your story, and just want to say what an enormous privilege it is to be sharing this space with you today.
Thank you. Thank you so much. For Dana, the Village of Healing focuses on Black maternal health. Can you speak a little bit more about Village of Healing and its mission, and what can the people in this room do to help support that mission?
So first and foremost, I'm honored to be sharing stage with Dr. Lasch and Dr. Porter. I've had the privilege of working side by side with them in the hospital, and I think they are both very, very amazing individuals and physicians. So I'm very, very happy to share the stage with them. And actually, Dr. Porter just delivered my little cousin about 3 months ago. So, and it was a very, very scary experience for her. So to hear his name when I walked in the room, it was just a relief. But a lot of people don't get that experience. When they hear certain names, have a relief. And so I think that was one of the reasons why I started Village of Healing. I think, at the time, infant and maternal mortality was coming to the forefront. And there were a lot of meetings and conversations. And officially, First Year Cleveland had come out to say that racism was the reason that we were seeing infant and maternal mortality, especially in Cleveland at the time. 7 Black babies were dying for every 1 white baby. In Cuyahoga County, I think the number was about 6 or 5. And the rooms, when you walked in, there would be 3 or 4 Black people, and everybody else was white in the room. But there was a lot of victim blaming. If you've ever sat in a room, you'll hear the term "these people." So there were a lot of "these people" conversations. There were a lot of "if they would just," but the research was all saying that Black people were going to their appointments early. It wasn't just Medicaid patients. It was also commercial insurance patients. It was 50-50 actually. All of this other research was coming out to say there's no other reason. People were saying Black people are going in really unhealthy, and then they compared it to white individuals that were going in with high blood pressure and obesity, and the numbers were still greater. But I was done talking about it. I was at an age where I was deciding on my own reproductive health. I wanted children. My friends were making decisions on if they wanted children. I actually just had a friend call me last week, and it was still a jarring conversation to say, I really want to get pregnant, but am I going to survive? Will I live or will I die? And so that was the conversations I was having. And so in my own experience, I just wanted to provide an action step. And at the same time, Bloomberg had just come out to say that Cleveland, Ohio was the worst place to live for Black women and second to last in healthcare outcomes. Cleveland Clinic is sitting right here, UH, Metro, but we were still second to last in healthcare outcomes. And I remember sitting in rooms and people thought it was exaggerated, but we knew it. I knew it as a healthcare provider, I knew it as a caregiver, and I knew it as a patient. And so I walked out of that last meeting and I was like, I have to provide an action step. And so we launched Village of Healing in 2019 as just doing mental health. But then in 2021, I decided to open the center. And so I did that in 2022 with the idea of seeing just about 40 Black women. That was going to be my stamp on healthcare. I had officially done it. I was like, yes, this is it. We saw 640. And so we recognized in that moment that this was a need. And people were coming in with traumatic birth stories. People were coming in saying, I never want to go to this hospital or that hospital. And so we were able to provide something that I felt like the hospital systems weren't, and that was just safety. It was walking into a place with similar lived experiences. You got to see individuals that looked like you, individuals that shared your same exact story in one way or another, whether, the statistics said it was going to be either their niece, their granddaughter, their daughter, or even themselves. And so we've been able to provide the outcomes. We've had 0 maternal deaths since opening our door in the last 365 days. In the last 365 days, we've had 0 infant deaths. And we have a 95% term birth rate, where the city of Cleveland is struggling to even get to, I think, 86%. And so we know what we are doing works. And we still get very sick individuals that come in the door. But we've been able to develop an amazing working relationship with Cleveland Clinic. So, one of the stories that we share is we had a patient come in, chronic hypertension, saw her through her whole pregnancy. She delivered, and when she came back, my nurse practitioner came in the room and was like, Dana, she doesn't look good. She was like, I don't know, her blood pressure is not through the roof. She just doesn't look like herself. And one of the benefits is we see our patients for the full amount of the pregnancy. So we develop these relationships with them. So we're able to notice like that postpartum depression. And it's up for Black women, but we still know 70% of Black women go undiagnosed or underdiagnosed. And so she said she just doesn't look good. And so I said, just bring her back in a couple days for a blood pressure check. And so they did, and her blood pressure was through the roof. She was getting very sick very quickly. We immediately reached out to our partners at Cleveland Clinic, sent her back in, and she had a bowel obstruction. They cut her bowel essentially when they did her C-section. And so the doc reached out to me and was like, if you didn't have it where they could come back that quickly, she would not have survived. And so she's now very healthy. She comes up just to visit us and bring the baby. I'm like, girl, I'm about to charge you for this visit. But we're able to develop that relationship with her. And so I think, what we've been able to do is build this family, this community, and this support system for a community that traditionally goes unheard, unseen, and completely ignored. And so your final question, what can you do? Tell your family, tell your friends, tell them that we exist. Word of mouth has been our best go-to to bring patients to the door. We accept all insurances. We accept no insurance. In addition to that, go to villageofhealingcle.com. We, of course, are a nonprofit. We get 3% of the funding that most organizations get. And that's just Black in philanthropy. We get 3% of philanthropy dollars based off of the other organizations. So, of course, any dollars that you can give, and just visit our website, visit our social media, pass it along, share your stories.
Thank you. say, I learned about Village of Healing through a friend who recently had a baby. She's a doctor, and I asked her, what would be a good community partner for this? And you were the top of the list because she had heard you speak before. She's like, she's doing amazing things. And then we asked another person who also had you at the top of your list, and then we talked with someone else who was like, how did you get in touch with them? They're amazing. So I think word is getting out about Village of Healing. People are very inspired with what you're saying. Okay. So I wanted to go back to good talk from a medical perspective about some of the other medical risks and conditions we should be aware of when it comes to maternal health. You guys decide.
Well, I think the biggest one for Black women is preeclampsia, eclampsia, any heart disease. That's the number one reason that Black women die. Number two, surprisingly, is mental health. And it's really not surprising, but those are the number two reasons for Black women when it comes to maternal mortality.
Right, high blood pressure being like a super common cause of obstetric complications, and hemorrhage being associated with maternal mortality also. So trying hard to optimize women's health, mental and physical, while before they're pregnant, ideally during pregnancy, and then in the hospital. We're always developing more systems and protocols to sort of standardize care so that warnings are easily identified and acted on. So those are programs that are nationwide, probably worldwide, but we focus more nationwide, like taking advantage of these systems to keep women as safe as we can.
The last clinical area that I think we haven't touched on is sepsis, which can often go unrecognized and undiagnosed, and that's a condition for which response times are really quite critical. And the other interesting and really troubling point is when you look at CDC data, the CDC defines pregnancy-associated mortality as anything from up to 1 week to 1 year postpartum. And so when you look at globally at causes of pregnancy-associated mortality, the majority are actually occurring in that postpartum period, in that 1 week to 1 year postpartum. And so that speaks to, in some cases, the exacerbation of hypertensive disorders of pregnancy and cardiovascular conditions that we see in the postpartum period, and also mental health concerns that often go unaddressed. And I think that speaks to a larger problem in our society where after pregnancy and the baby's born, it's kind of off you go. And we have a lot of work to do to provide more comprehensive support for our patients. And the story you told was so powerful because had it not been for the direct access that patient had to you in that immediate postpartum period, that condition might have gotten missed and it might have led to a different outcome.
I think too, really quickly, I sit on the maternal mortality review committee for the state of Ohio. I think it's so important for us to also recognize almost 65% of these deaths are preventable. That means 6 out of 10 essentially deaths that we see in the state of Ohio due to pregnancy-associated mortality, we can stop, we can prevent just simply by, ensuring that there's that access to care, that we listen and that we hear.
Yeah, that was so kind of the follow-on question I was going to ask was, what can we do? So, we can spread awareness for sure, and I think that can help an individual woman know what the risks are. Is it more, do you think the prevention is more on the medical side, or is it on the societal side, or where do you think we can put our efforts to actually try and improve these outcomes? Sorry.
I think it's both.
It's got to be both. Yeah.
I think it's both.
Yeah, it has to come from both. It has to come from, having the healthiest population starting out with healthy food, exercise, it has and healthy mental health, having a support system, as you know, is critical to maintaining everything. So if you don't have someone who can help you when you have trouble breastfeeding, when you are feeling down, feeling overwhelmed, you're definitely looking at a different system than someone who has family, friends, the medical system to support them. So we need both, and mental health support is I think poor. Like it's very difficult to access psychiatry, psychology. Fortunately, there are new medications all the time, like getting in to see a provider can involve quite a wait list. So that's something that definitely.
I just wanted to underscore the importance of the awareness piece, though, to start. I think there's still so many people out there that aren't aware of what a critical public health crisis we are facing. And I'll share a little bit of a story. When we were initial fundraising for our digital health startup, and we sort of pitched the idea for our software to these venture capital investors, and we quote the statistics, and they just couldn't believe that here in the U.S. we have the worst pregnancy-associated mortality of any industrialized nation, right? That it's a problem that's getting worse year after year. They couldn't believe that women of color have a 3 to 4 times pregnancy-associated mortality compared to their white counterparts. And by the way, a disparity that persists even after you control for socioeconomic status. So it's not just social determinants of health. So I was really surprised when I was sort of outside of a clinical space and public health space talking to the broader public how little awareness there was that people getting pregnant and giving birth today are less safe in childbirth than their grandparents were. And sort of let that sit and how do we tolerate that. So I think the awareness piece is really critical alongside, I think, following up with the action, which everyone's talking about, including new models of care to expand access.
I think too, the support system. You know, we have a model called our Pete's postpartum model, and mom and baby are seen together for their appointments throughout the first year because the first year is so critical. And so what we know is babies are constantly coming back for their appointments. So why wouldn't we just see mom while she's there too? And so we've introduced that into our system. And so now family members are now coming to those appointments. And you would not believe the amount of times that moms walk out to go to the bathroom and dad or grandma immediately are like, hey, ask them this, and this, right? And that's how we're able to diagnose a lot of our patients. It's because when they're sitting there, oh, I'm fine. Oh, yeah, I'm great. Even though, you know, for your appointment, you were coming with your heels on, makeup on, and now you're in house shoes and pajama pants. But we immediately are like, oh, they're a new mom. They're just really, really tired. But we have to look more into that. So I think support systems are great. If you recognize that something is not right with your family member, your friend, have that conversation, or let me go to your next appointment with you, or something like that, because that's how we're able to get a lot of people. It's because they're afraid to tell us, or they're like, I mean, yeah, I've had a headache for a week, but I'm tired. So I thought that's what it was.
I think that is such a great idea to have the moms kind of seen as well, because all of this discussion has unlocked a traumatic memory that I think I repressed up till today, which I think after my second child, I had postpartum depression. And I remember, you know, you have a baby, so you're super tired, you're super out of it, you don't really know what's normal. You're trying to just kind of survive, and then everyone cares about the baby, of course, and you do too, but you put yourself, definitely, I think new moms put themselves kind of at the back burner. And I think by the time I recognized I had postpartum and I tried to get an appointment for a psychiatrist, it was one of those things where it was like, you can wait 4 months. Ultimately, I was lucky enough that I talked to a friend who had a friend who knew somebody who basically was able to get me meds, but that is, I mean, you know, most people do not have that kind of access, and that was also just very coincidental. Like, I don't even know if I talked to my husband about it because I was so, you know, in that fog. So I feel like that is amazing, and it's such a good idea to see both at the same time. So Steve, I think you mentioned kind of something on these lines, but just want to hear what everyone thinks. So do you feel that we as a society or the medical profession are moving in a positive direction in terms of maternal health outcomes? Like, are things getting better?
I do think there is increasing awareness of this challenge. We're not necessarily seeing that translate into action or funding, frankly, against interventions to better support our patients. You know, the particularly concerning phenomenon that we're seeing has to do with the rural-urban divide. And, you know, here we are in Cleveland and Cuyahoga County, and we have our whole host of challenges in terms of that you articulated. But stepping outside of urban environments, there is a rural health crisis that's happening, and that's getting worse. That I was reading that over 200 hospitals that have labor and delivery units have closed down over the past decade, and there are about 2,400. I was looking this up. 2,400 hospitals in the U.S. that have labor and delivery. So that's about 10% of hospitals providing obstetric care have closed and are closing, and so that means that patients are further from care. And how are we going to? 4 million patients live in counties without an OB/GYN physician. So how are we going to tackle these growing problems when we are removing access to these essential services?
Yeah, so I'm going to answer no. Unfortunately, I don't think so. What we saw during COVID, I remember working at UH during COVID, and we thought that the numbers when they came out for maternal mortality were going to be much lower because we provided a different type of service. We provided telehealth for individuals during prenatal care and things like that. And people said that, Black women wouldn't have to go into the appointment, so they wouldn't have to walk into toxic hospital environments, and racist hospital environments. They would be able to stay at home and then do the telehealth. And what we saw was that the numbers increased. They were actually some of the worst numbers. And I was able to see that firsthand too. I remember from prenatal appointments where I worked for prenatal care, there was a lot of, no, they can't bring their support person in here, but we heard the other clinics were allowing a support person. So I was at one of the health centers that's in the Black neighborhoods. So they weren't allowed to bring their support person because, they might have been out at a party or something last night. These were the literal conversations that were happening. So I think especially for Black women, no, it's not getting better. We just saw, you mentioned her, a certified nurse midwife, a doctor prepared certified nurse midwife, Black woman lost her life after childbirth. And so I think that until we are ready to truly have the conversations, I think that we always talk about culturally sensitive care and bias training. Once doctors and midwives walk into the profession, we need to start having those conversations in medical school because that's where the training is happening. We need to start having those conversations in midwifery schools and midwifery classes. But until we truly, truly address what is happening, why it's happening, and then try to figure out how to create that system from there. What we know is hospitals were built over 400 years ago to keep Black people out. They were literally, when they were built, they said, allow these enslaved individuals to die in the streets because they should have been enslaved. And so we're going to show them. And this was the system. And now we're asking for this system to change overnight. It's just not going to happen. And so for me, no, I don't see it getting better. I see it getting better with transformative healthcare. So places like Village of Healing, birth centers that are Black run and Black operated, opening. That's where we're seeing the difference happen.
So I think we're seeing more programs in high schools encouraging Black students to go into healthcare that previously we didn't have. So hopefully that will be part of making a big impact on care. But I know UH has some programs like that for high school students. And then rural programs too, encouraging those students to go into healthcare too, to serve their communities. Be another way to address like these consistencies in care. Yeah.
Okay, so this is my last question, and then maybe we can have some audience questions. That's okay. So, all right, this is kind of separate. I was thinking about how culture impacts views on maternal health. I was speaking with my sister-in-law recently, and she's from Taiwanese traditional. And she was saying that in traditional Chinese culture, there is and always has been a very explicit understanding that every childbirth is the potential to lose the baby or the mother. And she was saying there's even like a Chinese idiom about it. And I was born in a very kind of assimilated household. And so I did not go into it thinking that this was, something that could possibly happen, because I think in general, mainstream American culture really glamorizes and idealizes like being pregnant, having a baby, let's do a gender reveal. Nobody wants to talk about this kind of really scary stuff. And I was just wondering if you guys have any personal thoughts on this kind of thing, because to me, I still am kind of struck at how beautified we make all of this, and how we don't talk about like the really scary things that could happen. And I do know that personally, after I had my experience and I shared it with people, there was always somebody who knew somebody or something happened. It's just we didn't talk about it. But anyway, do you guys have any thoughts on kind of the cultural impact on how we go into childbirth and people's awareness of the risks involved?
I think we put a lot of influence on pregnancy, and then we discard after. Everybody's focused on those 10 months. There's so many programs for those 10 months. There's so much help for those 10 months. And I think we put a lot of emphasis on womanhood equals motherhood. And so I'm even noticing that myself as I've made a decision to not have children. People are like, you don't want children, And so I'm always having conversations with, my patients. Your womanhood is not attached to you being a mother. And I think especially in Black culture, we do that a lot. The purpose of being a woman is to become a mother. And so I do agree with that. We glorify it. We give so much attention to those 10 months. We give so much assistance in those 10 months. And I think it's one of the reasons that we do have such a high maternal mortality in that first year. Because once that baby is out, we see it in policies, right? Everybody wants children. Let's have children. Let's do these 10 months, yes. And then once that baby is out, they're like, we're not going to help you feed them. We're not going to help you get them medical care. We're not going to help you get them educated. All of that's on you. You make the decision to have them children, so that's on you. And so I think we put a lot of emphasis on that.
I think as a medical professional and in obstetrics, myself and my colleagues, we fear the entire pregnancy. Each little point you worry about what's going to go wrong, and when you get to a certain point, you feel like you're a little bit in the clear. Yeah, I think we walk around with that fear. I mean, we don't want to spread it to our patients, but it's there. Yeah. It's 24 weeks, thank God.
Yeah.
For many people that's very early, but for us, we're like, things are looking really good. So, I don't know. It's a fine line between, fearing the entire pregnancy and trying to be as happy as you can about it. And really, family and friend support is really just so critical. Sometimes new moms don't have that. A lot of moms work, and so finding that support in some way, I think, can be really challenging. It can be really lonely being a mom in these times. There's not as many stay-at-home moms, and when you're home with that baby, you're alone. So I was just talking to a patient, and she was feeling very lonely at home, and she said, we have a great community where I live, but it's really, we see each other outside. We don't see each other through the winter as much. And I said, well, you got to call and ask someone to come over and hold that cute little baby, and just asking them to come and hold the baby can be, so helpful for support and a little bit rest for mom. So if you like babies, if there's someone on your street that had a baby, ask if you can go over and help, because you might find out you're going to do a lot more emotionally for that mom than you think. So we're talking about if you're a grandma and you like babies, somebody had one, please ask. You go hold the baby, because you'll probably give so much to that mom.
Thinking about your original question, Melody, one of our colleagues says that one of the things that makes obstetrics one of the most unique and challenging clinical areas is that obstetrics and labor and delivery is the one area of the hospital where patients come to the hospital expecting a good outcome. as they should, right? They want to expect to go home, healthy mom, healthy baby, and really any other area of the hospital, you're going to the emergency room, you have a cancer and you're seeing your oncologist and you're desperate for a cure. You're hoping for something, and obstetrics is, it's a little bit different. There's this expectation, well, you're gonna, we need this hospital, healthy mom, healthy baby. And so when that doesn't happen, I think there's a tremendous disconnect between what those expectations are and then what the clinical realities are. And that also ties into, I think, why we're seeing such high rates of birth trauma of patients, because of that disconnect where patients expect a certain experience and there's something that happens that, might seem very routine on the part of the clinical care team, but is actually deeply traumatizing for the patient who experienced that. And so I think always doing our best to, one of my colleagues has a slide where it's sort of a side by side of what the patient is experiencing, and it's sort of a pregnant mom like in a field of flowers and sunlight on her face, and then what we're imagining, which is some sort of like a ruptured appendix or an abdominal aortic aneurysm, some sort of crazy surgical emergency. And the reality of those experiences is, hopefully somewhere in between those two. But the disconnect, I think, is so profound that really creates that opening for trauma when it doesn't.
Yeah, that's really interesting. And I never realized that Elise and like healthcare professionals do look at it with all this risk. It's probably because you're probably not taught like it's a great bedside manner to be like, by the way, we might die. It's not something you want to tell a pregnant woman. But it is good to know though that at least you guys are aware, and that's why when these things happen, you can come in and do your work. Do you think we have time for questions, or should we? Okay, 5 more minutes. Does anyone have any questions?
I just want to go back to your point about what you said earlier about homelessness. Okay, I grew up in a little village. Thank God. I did. It wasn't that long ago. Literally, you go to your neighbor to borrow a cup of sugar. Whatever happened to our culture? Okay, so what you say? Yeah. Go hold the baby. I love being Auntie Chai. I'm Auntie Chai to lots of people ever since all the way to college. I can't do much, but I can change a diaper. I can't come hold the baby. This is where it is all. Let's be who we are, Americans, not afraid of each other. You do not need a camera on the doorbell. Go ring the doorbell. Bring the cookies over. Let's just go back to simple, just being ourselves, be neighbors. Look at what's happening right now. Look what's happening right now. It's the first time in my life I cannot change the way I look. And I actually tell my friends, please do not let an ICE agent come near me, because I will be hauled off, because I'll be reciting my constitutional amendments rights. Why should I be afraid? I grew up here. I am. We are a community here. We need more babies. By the way, our birth rate is really low. Please have more babies. Okay, that's it. I'm going to shut up.
Good for the economy to have a baby, so thank you, Sam.
More questions, anyone?
Well, I'm curious what your opinion is, because it seems to be an ironic disconnect that people, especially in the political arena, are obsessed with fetuses. Yet, as soon as the fetus comes to be a child, where's the care, and why do they stop caring? Does it seem, or is this all in my head? Do you think there's a huge disconnect? And like in Iran, it's irony that you're obsessed with this fetus, you're anti-abortion, yada yada, but as soon as this baby comes in the world, you don't want to have anything to do with it. Is there any way, I'm sure this might be politically charged, I just want your opinions on if it is, what can be done, to bring that disconnect together?
Vote.
Right.
That's the biggest thing that I can say is vote and vote in your interest. We get people that vote against their own interests. And so, I agree. That's what I said. There's such a focus on motherhood for 10 months, and then we drop people in that year. And it's also, I think, like we said, it's one of the top 3 reasons, depending on race, but number 2 for Blacks, but top 3 reasons is mental health. That we have the maternal mortality rates that we have. And so there is that loneliness. There is all of that. So I think the only thing is, at this point that we can do is vote and make sure you vote in your own interest.
Right. In Ohio, we're fortunate that we have Medicaid expansion in states where they don't. And your health, as a woman, your health care ends when the baby's 6 weeks old. It's crazy.
I think it might be one
Which is why we gotta vote.
way. Right.
Given the dramatic difference between our statistics in terms of success across the board versus other countries, can you tell us about what you think are some of the primary factors for, say, for our failure or for their success? That it's so dramatic. It's not just some of the things you mentioned, but other related health-related statistics, which and having. So would you like to opine on how come they're so much more successful?
This is my bias, but it is also backed by statistics, midwives. A lot of the other countries utilize midwives a lot more. We are blessed to have all 3 hospital systems here that provide midwives, but it's a choice. In other countries, you work with the midwife and doctors are there to back the midwives. And so midwifery has been shown to have better outcomes. And so a lot of those other hospital systems use that. I think it's also culture. It is the family feel. It is the connection. I think that has a lot to do with it. I think it's why we have, the success rate we have at Village of Healing. It's the culture, it's the connection, the family feel. And like this young lady just said, we've lost that here. So I think that has a lot to do with it too.
So specifically, I'm wondering, do you believe that that cultural competence is one of the disconnects for why this continues to happen?
Absolutely. Absolutely. And like we said, there are a lot more conversations around how do we get Black providers. This is one of the reasons you vote. There's a House bill that was just introduced to try to provide funding for midwives in underserved areas, the rural areas as well, to get through school. I don't have shame in saying this. I graduated with $180,000 in debt. Everybody's not willing to take that risk. And go to school to become a midwife, especially if you're from an urban community or a rural community and you're from a culture that doesn't have that generational wealth. And so to be able to help these students get to this point is essential. So yes, I think cultural sensitivity and cultural responsiveness is definitely one of the major reasons.
You also have to wonder about our food. I feel like our food has changed so much in the last century that maybe the way we eat is part of our poor health going into pregnancy and during pregnancy. It's probably one very small part, but maybe something that we could do some work on.
Do you believe in dualism?
Absolutely, of course.
It goes with all of our births.
Yeah.
Absolutely.
Any more questions?
Hi, I'm wondering about the midwife question. I feel like in the U.S., there's pregnancy and childbirth are kind of medicalized, and not many women are educated on how they can empower themselves to go through the process. I gave birth to 2 children, and with my first, it was rather traumatic. So for my second, I educated myself. I read a lot of books on midwifery. I hired a good doula. I had a not so great doula the first time to help me through the second one. And there were things that I read in the midwife books that were not discussed in my Lamaze and pre-childbirth classes. So why do you think American women aren't more empowered to help themselves through childbirth?
So I don't think that they're not empowered. Um, when we first started Village of Healing, and a lot of the doulas use the word advocate for yourself, or teach you to advocate for yourself. And then I was pro that. And then I had to go to the hospital myself. I had high blood pressure, first time 190 over hundreds, 200s over 100s. And I sat in that ER, and I'm a midwife, right, with the healthcare center, and I could not advocate for myself. I was at my most vulnerable. I was very, very sick, and I couldn't advocate for myself. And so I don't think that we're not empowered. I think that, first of all, we're a lot more medicalized. Like Dr. Lasch said, we in our home, when you get to 24 weeks, we're like, yes. My friends, I used to joke and say, every time I enter a room, I'm waiting for something to go wrong in a delivery or in prenatal care. And so I think that, first of all, we're a very litigious society. And so that has caused us to become more medicalized. And I think that a lot of times too, especially I know in Black culture, the doctor is always right. So we don't question him. We don't, say, can we do it this way or can we do it that way? And so I think that, empowering yourself is great. And I think a lot of people do it, especially in pregnancy. But a lot of times when stuff is starting to hit the fan, it's like, I just want to be safe. And so, yes, do whatever you need to do to ensure that I'm safe.